Hello, and welcome to Health Matters, a show about health issues and interests facing our community. I'm your host, Gilda Kramer. I'm a Lower Merion Township Commissioner, and I chair the Board of Commissioners Health Committee. Today, we're going to be talking about coping during COVID. My guests are Shawn Kraemer, Bill Leopold, and Courtney Reed. Shawn Kraemer is a licensed professional counselor with the Center for Psychological Services in Lower Merion Township. Shawn's areas of expertise include substance abuse, depression, anxiety, relationship problems, and grief. Shawn is also running unopposed for commissioner in Ward 8, which includes parts of Linwood and Ardmore, and will be joining our Board of Commissioners in January 2022. Bill Leopold is a social worker working as a behavioral health consultant at a federally qualified healthcare center in Philadelphia, and is on the board of the Palm Senior Center in Ardmore. Bill is a member of the Health Advisory Council of Lower Merion Township. Courtney Reed is the director of Lower Merion Counseling and Mobile Services, a part of Resources for Human Development, Inc. LMCMS is a local nonprofit behavioral health provider with locations in Ardmore and Bryn Mawr. Many people in our community have been struggling in different ways during the past year. Bill, what have you seen in your practice?
Thanks, Gilda. I work in Philadelphia as a behavioral consultant in medical clinics. We have primary care, OBGYN, and pediatrics, and we build in behavioral health as part of the team in what we call an integrated model. We both do treatment and refer to clinics and psychiatrists as needed. We see not only increased stress, but also worsened medical conditions. People have more trouble keeping medical appointments, controlling diabetes and their weight, for example. It's critical to keep up with your doctor visits, including dentist checkups, which people forget. Fortunately, this is easier now as people get vaccines. I'm also on the board of the Palm Senior Center in Ardmore. Seniors particularly suffer from isolation and lack of stimulation. At Palm, we've opened for virtual classes and providing food. We've obtained grants to help reduce isolation by increasing access to Wi-Fi and computers, as that's a lot of the way people make connections now. This will make it possible for our seniors to stay closer, not only with our programming, but especially with their families, both now and when the pandemic's resolved. Last, I'd say I see a lot of increase in anxiety and depression. People get more anxious and depressed when we don't have control of things, when life is unpredictable, when there's less structure in our lives and less contact with people. There's also more of a tendency to turn to whatever substances we might use, like alcohol and marijuana. Shawn, what have you seen in your practice?
I've seen the same, as you're saying, Bill. So many people are feeling uncertain about the future, and so they're feeling more anxious and they're more depressed oftentimes. I see a lot of adolescents, and it's been really hard for adolescents to cope with online learning and being isolated from their friends. It's been hard for people to keep a sense of structure and routine, like you said, and that can just really make people feel not themselves.
Courtney, what have you been seeing?
I think similar. I think, this pandemic has been really, really hard for everyone. And I think sometimes we just have to give ourselves a little bit of a reprieve on what's going on and how we can support each other through this pandemic and utilizing the resources that are available in the community for the needs that we all have.
Shawn, I know you have children and are also working and trying to work from home. Does that pose any special challenges?
Yes, and so many people are in the same boat. A lot of my clients are in that boat too, right? Trying to manage businesses or work from home and kids. And it's been tough. I count myself lucky, and it's still been really difficult. And I know that even with people who have very small kids, like I know Courtney has, it's even more challenging because they need hands-on care all the time, but you still need to work. So I think that parents these days are doing a phenomenal job, but it's been extremely stressful. And people find themselves running on empty a lot of the time. I often tell my clients, just keep it really simple. We're just trying to get through day to day right now. You don't expect miracles of yourself. Don't expect a normal amount of work to get done. Just get through it. And let's all get through it in one piece. It'll be over eventually. If the kids are watching more screen time than usual, so be it. If you're eating, pancakes for dinner twice a week, so be it. Just got to get through it, get to the other side.
Courtney, well, you have very young ones. What special challenges are you dealing with very young children?
I think, we're fortunate enough to have family support. And so utilizing family when we can and asking for help when we need it, I think is really important. Shawn and I were just talking about how beautiful it is finally getting to be outside. It's springtime now. And so being able to take the kids outside is such a incredible benefit to where we're at right now.
One of the things that I've been wondering about is I get weekly reports of what's going on in the township, and I see a lot of domestic disturbance reports. Have you been seeing those in your practice, Shawn?
Yeah, I have, tensions that may have been there prior to the pandemic are often, exacerbated by the pandemic because everybody's stress levels are higher, finances are less certain, kids are home, and, all the things that we're all trying to juggle raises tensions. And in addition, many people turn to substances to manage, and that can make people's behavior less predictable. It's been challenging for a lot of people. So yeah, for sure, that's an issue.
I also have noticed that young people are facing particular problems because their social life is basically put on hold for a long time.
Yeah.
Courtney, I don't know whether you deal with the young people, or Bill, whether you're dealing with them, or Shawn. What do you see any special challenges for the 20-somethings and 30-somethings?
So I can speak to that. So I've seen such challenges for people that are, in high school and college and young adulthood, whether they missed out on graduations and all the fun that comes with senior year, or trying to manage the stresses of junior year of high school, prepping for standardized tests and trying to, make your transcript look great at the same time as you're home and doing school online in your house, not leaving for days at a time, not seeing friends. Those are all stresses. And then trying to find jobs or do college from at home rather than with your friends on campus. Those are all challenges that I've seen people struggle with.
Thanks, Shawn. I'm sorry I'm going to have to interrupt our conversation now, but we do have to take a break, and we'll be right back with more Coping During COVID on Health Matters. Stay tuned. Welcome back to Health Matters, a show about the health issues and interests facing our community. I'm your host, Gilda Kramer. I'm a Lower Merion Township Commissioner who chairs the Health Committee. We're talking about coping during COVID. Before the break, we were speaking about how it's normal to be struggling and feel bad during this pandemic. Shawn, do you have any suggestions on how people can cope better during this time?
I do. The first thing that I tell folks is to just focus on your basic self-care. Make sure you're eating regularly, sleeping regularly, not too much or too little, and showering and dressing, and moving every day. These are all things that we know create a sense of normalcy and well-being. Also focusing on a simple daily routine to create a sense of normalcy and create a separation between work and home if you're working from home, particularly going outside for a little bit can really kind of create that sense of separation that can help you wind down and shift gears. Going outside every day, or sitting near a window if you can't go outside every day, also helps with mood. We know that vitamin D and sun really do help with stress and with depression. So I recommend it for all my clients. Connecting with other people, if it's in person, distantly, and outside if you can, online or on the phone, connecting. We're all in the same boat, the whole world, and it really helps to touch base with other people that we care about, or even new people that we might be able to reach out to. Can really help lift, that sense of isolation that so many of us feel. Often, I find it that people also use their social media, to connect with people, but some of us are using it too much. And the way to know about that is to see, are you feeling stressed after you're reading it? And if you are, take a break from it. It's okay. Anything big that's going on, you'll find out about, later on after you're feeling better. I tell people to keep the long view, to keep perspective in the grand scheme. Even though this feels endless, it's not. It is going to end, and we will have this behind us. So to remind ourselves that this is a small part of our long lives, hopefully, can be helpful. I also tell people to, take it easy on yourself and take it easy on other people. Like Courtney said earlier, it's okay not to be okay. It's okay not to do as much as you used to do. Give other people a break too. We're all juggling. Check your worry. If you're finding yourself going in circles, check yourself and ask for help if you need it. Talk to others who can help you get out of that cycle of worry. Those are some of the basics that I find are helpful.
Bill, do you have any suggestions to manage during this time period?
One of the biggest areas I've found in the pandemic is that people sleep even worse than they used to. Sleep has become an epidemic problem. Before the pandemic, I would talk particularly with young people about the impact of cell phones, because to get to sleep, we need our minds quiet. And what you're doing if you use a cell phone or screen an hour before sleep is you're waking up your brain. What I often find with sleep is if people don't get a good night's sleep, which will be different at different ages, depression is worse, anxiety is worse, you get angry more quickly. So I always start with getting sleep, what's called sleep hygiene. What are the habits? So for example, 2 weeks ago, I was working with someone who claimed they drank 2 sodas a day and their daughter said 10 to 15 sodas a day. And I instructed that if you read a bottle of soda or a can, you'll find that there's a huge amount of sugar and caffeine, as there is in regular tea or flavored water. Caffeine throughout the day and sugar are both things that really impact the body. Think of kids coming home from Halloween and how wired they are. That sugar makes a difference. So I suggest first simply writing down what you're doing. How many bottles, how many ounces, how many cigarettes a day or bottled drinks. And then once you've done that as a baseline for a few days, then start cutting down. So you really need to get good sleep hygiene and good habits. You need to check with your doctor if some of it may be medications. If you're taking over-the-counter sleep medications, be very careful on how much Tylenol you're getting all throughout the day, because that can be liver toxic, especially if you have liver problems. And don't be shy about talking with your doctor. There are some medications that can help, but getting that good night's sleep really, really is critical.
Courtney, do you have any specific suggestions on how people can cope during COVID?
Yeah, I think just to piggyback off of Shawn and Bill in the fact that about self-care, I think self-care is so important to be doing right now, especially if you're a parent, if you're a caregiver, if you're a teacher, if you're a healthcare worker during this pandemic. It's really important to do things for yourself, treat yourself, do some things that you can do to take care of yourself. Like Shawn mentioned, going for a walk around the block, something so simple, just getting some fresh air or some sunshine even on your face if you just open your blinds a little bit. Just doing something for yourself to care for yourself is really important. And asking, if you live in a household that has more than one person, asking for that time to be able to do that is really important.
How important is it to draw on your friends and family and your worship communities in maintaining your sanity during this difficult period?
It's critical. We all need each other more than ever. So if you have people that you can reach out to, do it. They probably need you as much as you need them. And I think that people find great sources of strength in their communities. I know for us, it's been tremendously helpful.
I know for us personally, having weekly Zoom calls with our 3 kids and grandkids has made all the difference. This is again part of why we want to get for poorer people and for seniors to get access and knowledge of how to use computers. Zoom, for all its strangeness, has been a tremendous boom. And don't be, I had one older relative who had to be forced into a room for a family Zoom and then found it terribly enjoyable. Any way you can connect. There are support groups online for alcohol and Alcoholics Anonymous. There are cancer support groups online. Think of any kind of condition, including for the different peer groups for people who have mental illness. And there's some very excellent peer groups one can get in touch with.
I unfortunately have to interrupt again because we need to take another break. We'll be right back with more Coping During COVID Matters on Health Matters. Stay tuned. Welcome back to Health Matters, a show about health issues and interests facing our community. I'm your host, Gilda Kramer. I'm a Lower Merion Township Commissioner who chairs the Health Committee. We've been talking about coping during COVID and strategies to cope during these difficult times. Now we'd like to talk about when and how to get help. Courtney, do you have any guidance on when someone should get professional help?
Yeah, sure. I think it's really important to realize where you need support. And if you're doing things outside of your normal routine, if you're more irritable than usual, if you're arguing and losing patience more than usual with friends or family, feeling very lonely, persistently worrying about things, as Bill had mentioned earlier, staying in bed a lot, not sleeping well, missing work or school, getting behind in work or school, drinking more or using substances more often than you typically would do, feeling like you would like to harm yourself or thinking about wanting to do those kind of things are definitely instances where it would be really important to seek some professional support. I would say if you're experiencing that for about 1 to 2 weeks as an adult or 1 week as a child.
Bill, do you have anything to add on when to get help?
In the medical clinics, we use some brief screening tools, and we can also make those available. There's a depression screen of 9 questions and an anxiety screen of 7 questions, and we can post those later. And they give you kind of a sense of the issues of depression, how often you have them, and when you might want to seek some help. But if you've lost a lot of energy, if you have what we in our jargon call anhedonia, you just don't have much interest in anything. It's hard to have fun. It's hard to have pleasure. If you're finding your mood is swinging back and forth more than usual, certainly if you're thinking or planning anything about self-harm, those are all indications. And in addition to talking about therapy, you can certainly talk to your doctor and they can be a good source for therapy, your insurance company. But when you see those signs, you need to get help. There are also some increasingly good tools online, such as meditation apps and breathing and yoga. And those are things particularly for anxiety and anger management, where you really get a better sense of how to be calm instead of be angry. That when you're stressed, there are techniques that are well established, scientifically validated that you can use. And a lot of those are available online, often as a supplement to seeing a therapist.
Shawn, when should somebody go for help immediately?
So like Bill said, if you're thinking about dying, if you're having thoughts about not living, or especially if you're having thoughts about how you might end your life, definitely seek help immediately. Go to an emergency room, call 911, and get in front of a clinician who can talk to you and get you the help that you need. Similarly, if you are thinking about hurting someone else and you feel like you might not be able to control yourself, that's an emergency, and hospitals can help you then. If you find yourself hearing things that you wouldn't normally hear, or that other people don't hear, or seeing things that other people don't see, or having strange ideas that other people don't seem to understand, and those are persistent, that can also be a sign of, anxiety, depression, and other things that we can help you with. If you get in front of a person, you don't have to suffer with that. And the last thing I would say is, if you feel like you can't go a day without a substance that you use regularly, alcohol or any pills or any other kinds of drugs, we can help you with that. Go to a hospital, call 911, and we can assess you and get you the help that you need. Those are all emergencies.
Courtney, how can somebody who needs help get help in Lower Merion Township?
Yeah, so there's a number of different options based off of insurance and different things like that. So we have support in Lower Merion Township with private pay. You can ask friends, family, clergy, your primary care doctor, reputable sites like Psychology Today to find those resources. If you have commercial insurance, similarly to the others that I mentioned with private pay, you can also call your insurance company to find out your in-network providers. And if you have Medicaid or Medicare, there are a number of community behavioral health clinics in Montgomery County that individuals that live in Montgomery County can utilize, including Lower Merion Counseling and Mobile Services is the agency that I work at, and where we have 2 locations in Lower Merion Township. We have one at 850 West Lancaster Avenue in Bryn Mawr and 9 Cricket Terrace in Ardmore. And we can provide services like intake, assessments, individual and group therapy, psychiatry services, case management for children and adults, peer support services, so individuals with lived experience that can provide support to those, as well as administrative case management. And that services, if someone is uninsured, we can help get them set up with insurance. And we'll provide some resources during this show that you can utilize to get access to the things that you may need, whether it's for immediate help or ongoing support.
Bill, are there emergency services available for people also?
Yes, there's a number of numbers we'll post. There's a national 800 suicide hotline, staffed 24 hours a day, that then goes into local communities to help. There are warm lines where it's more, you're not sure you're suicidal, you don't feel very good, you want someone to talk with, and sometimes people feel more comfortable. There are text numbers 24/7. So if you're more comfortable in texting than in talking with someone. There are similarly phone numbers or text lines for veterans, people who are trans. There are a number of specialized circumstances where you can, and a Spanish hotline. So 24/7, you can always pick up a number. It can be 911, but any of those numbers will be available 24/7 to help give guidance.
Well, I think that's all we have time for on this month's show. I want to thank my guests, Shawn Kraemer, Bill Leopold, and Courtney Reed for being here and sharing your expertise. I'm Gilda Kramer, and I'll see you next time on Health Matters.